Welcome to Leading the Way, a video series about addressing challenges in biomarker testing. Today, you will hear important insights about biomarker testing standardization in advanced ovarian cancer from Dr. Michelle Shiller, a molecular pathologist at a major academic institution.
Hi, I'm Dr. Michelle Shiller, and I would like to share some helpful tips on how you can standardize biomarker testing. I have spearheaded improvements in several biomarker testing processes within my healthcare system. I did this because while attending tumor boards, I realized that we often did not know which patients had been tested. Testing is a vital part of care, and without this information, we would not be able to make the most informed decisions for our patients. We wanted to ensure that everyone received the same high standard of care. So it became clear to me that we needed a better approach. Today, I would like to share my experiences with you. In this series, I share strategies that my team and I use to standardize testing for homologous recombination deficiency, also referred to as HRD, in patients with advanced ovarian cancer. The purpose of this chapter is to share how we reached a consensus that there was a need to improve our approach to HRD testing in advanced ovarian cancer. It has always been our clinical team's goal to test all appropriate patients for homologous recombination deficiency. However, in reality, we were not testing everyone who needed to be tested. In collaboration with my surgical pathology colleagues, we were able to count the number of patients eligible for testing versus those who had undergone testing. These data were eye-opening for the clinical providers and helped them to align on the need to standardize our approach to homologous recombination deficiency testing in ovarian cancer. My strategy was to focus on education rather than persuasion. First, I shared our current biomarker testing rates across the institution. This helped illustrate to the team that a large number of patients were being missed and motivated them to change our approach. Second, I found that it was productive to provide key decision makers with evidence-based guidance around biomarker testing as the standard of care. Finally, I had to consider the unique role that pathologists play in biomarker testing. Pathologists may be seen as having institutional biases or preferences around testing services, so it is important to remain neutral and objective. As pathologists, we provided information and let the clinical team make the decisions around the testing preferences that would be best for their patients. Initially, everyone did not agree on the need to change our approach. To drive consensus, we shared objective evidence across the institution, including our current testing rates and evidence-based guidance around testing. This helped the team see the need for themselves and motivated them to change our approach. With this consensus in place, our team began developing a standard protocol for testing. To hear more about approaches to testing standardization, please click the link below.